90-90 internal hip rotation. Now the intention of this exercise is to increase the capacity or the range of movement at the capsular level of the hip. Using this base position, we can increase capacity of the hip for the movement of internal rotation. We set up into the 90-90, 90 degrees, 90 degrees, and then we can then adjust accordingly depending on your comfort level. If you find it difficult with the front leg, you can bring it in. We can take that out completely. We can go back to crossing, and we can pull in. What's important is the intention is clear that we want to affect this joint in the internal rotation direction. Sensation should be both on the top and underneath, but not at the front. From here, because the leg is the fixed point, we would then try to maneuver the rest of our body into a position that gives us the best passive load or best passive stretch. We can start to rotate around. You can start to drop the hip, or we can do both. Okay? Once you find you're settled into your internal rotation, you would then sit and nasal breathe slowly in, slowly out for up to 2 minutes. Once you've reached that 2-minute mark and you've overcome some of the stretch tension, neurological tension, it's then time to do our pails and rails. So again, we'll use the image of a sort of submarine door or a big wheel. All right, and if I took a cross section of my thigh, there would be a circle. We want a direction or a rotational direction to where that circle is twisting to. And the first one is always to load the tissues that have been on stretch. In this instance, it's going to be then to push the foot down into the floor with the knee feeling light. That means that the femur is going to be traveling to the outside towards the foot as we rotate down, using the external muscles here in order to help rotate. Okay, we place into the floor, take a breath, and then start to drive that foot down into the floor. The knee starts to feel lighter, although it stays on the floor, and we start to rotate that hip down towards the floor. We get up to our intensity, we irradiate tension into the rest of our body, hold for the allotted time, and then we would then immediately switch to a rails contraction. That means pulling deeper into internal rotation. This femur then would then imagine or look as if it was going to rotate down into the middle using all these muscles on the inside of the leg. The knee is driving down and the foot is feeling lighter as if it's going to drive and be able to pick up off the floor. Okay. The direction of the femur is down in towards the midline. 4, 3, 2, 1. Slowly release, back to nasal breathing, and then to see if you can then start moving the body again to encourage a little bit more passive room. Rinse, repeat, as written in your program.